Welcome, everybody. I appreciate everybody's time tonight. I'm going to try and keep it flowing as quickly as possible. I'm going to put everybody on mute so that there isn't any background noise or interference. If you do have a question, I can see some of you on the right-hand side of my screen, and I kind of cycle through to see people's reactions and see if you're raising a hand. If not, at the end, we'll take questions. I've tried to make this one a little bit shorter in some respects so that we can get through it and have a little bit more time in the end to interact and ask questions. But, again, if there's something pressing during the course of the presentation, please, by all means, try and ask. This topic that I'm going to go through tonight is one that I'm going to give two very distinct examples at the end to demonstrate the different ends of the spectrum of what it means to truly take control of your care. And by taking control of your care, I don't mean just collecting your medical records and making phone calls and sending emails. I mean actually taking control of your care. And when the doctors and your clinical care team isn't doing what you need them to do, how to get that to happen, and when that doesn't happen, going ahead and putting your hands on the steering wheel completely. So what we're going to go through is, again, what does it mean? And I just talked about that a little bit. From diagnosis to treatment, when you may have to act, when you may have to take control. Number three, why you may have to act. Real world examples. Like I said, I want to spend more time on the two examples because I think they illustrate two extremes and two experiences that a lot of people can relate to. The one experience, after I tell you about it, I don't know that any of us are going to be able to relate to it, but it has some good lessons. And then talk about some considerations and then answer some questions. What exactly is taking control of your care? What does it mean? Like I said, there's a lot of instances after you or a loved one is diagnosed with a serious illness or life-threatening illness where you're going to be interacting with your clinical care team. And last week I talked about how to create the best relationships possible with your clinical care team. But there's points and times where you as a patient or you as a patient advocate for your loved one or your family member, friend, don't think that they are getting the care that they deserve, or that the doctors just simply aren't pushing as hard as they should. Whatever it is, it doesn't matter. I'm talking about a situation where you actually have to say, step aside, it's going to be done a certain way. You can either help me or not help me, but we're going to get it done. And it's a more extreme approach that you have to take sometimes. But when you're talking about somebody who has a life-threatening condition or is terminal and they're in pain and you're trying to ease their pain, then it doesn't matter. Doctors and clinical care teams fall all along the spectrum. The time that they get to spend with us is not increasing, it's actually decreasing. So it falls on our shoulders to ensure that we are advocating to the best extent possible. And what's the outcome that you're looking for? What do you have to advocate for? If it's, in my case, with my daughter who was diagnosed with an inoperable and terminal brain tumor when she was 27 months old, she couldn't communicate. She couldn't advocate for herself. By communicating, I mean, she couldn't really tell us how she was feeling. I mean, we could see how she was feeling, but she certainly couldn't advocate for her own care. There were points and times where, because she was so young, she needed MRIs frequently, and she had to go throughout the night without eating or drinking water and had to wake up and do the same. She was on steroids to keep the swelling down in her brain. One of the side effects of those steroids is it made her ravenous. She would eat like crazy, and she gained weight, and she was a small kid to begin with. And there were points in times we would show up for her MRI, which was scheduled for 7:30 in the morning, and the anesthesiology team wasn't there, and they were running late, or they tried to squeeze somebody else in before, and we had to take control of her care. It wasn't just a matter of saying to them, "Oh, that's okay, no problem, we'll wait." We did that. We did that a few times. After a few times, it wasn't acceptable to watch my daughter be miserable and not be able to eat. So there were points in times where I had to not go ballistic, but advocate pretty heavily for her. We're talking about extreme instances here, but advocating and taking control of your care can also mean other instances where you don't have something as pressing, but nonetheless, if you don't speak up, it's not going to happen. You're the one who's doing it. Or if it's for your loved one, family member, it doesn't matter. Doctors and healthcare professionals and clinics and hospitals are so overworked and so overwhelmed. And just think about what's going to happen if the Affordable Care Act gets repealed, which it looks like they're on the road to doing. So many people are going to fall off this cliff of not having insurance. Think about the doctors that are going to be treating the multitudes of patients that don't have insurance. You're going to have to step up your game and take control of your care even more because of the increase of cases of people that aren't going to be able to be insured. Or, in the case of kids with cancer, they will always have a pre-existing condition because they're left with lifelong and acute serious illnesses, secondary cancers. They're not going to be able to get coverage because the pre-existing exclusion, pre-existing condition exclusion is gone. So there's going to be points and times that you may encounter for yourself or somebody else where you've got to go ballistic, or you've got to take complete control of your care to a point where once you find the clinical care team or the physician or whoever it is that will help support what you need to do, then stick with them. From diagnosis to treatment, when you may have to act. And I put the ice bag on there because you can get a headache having to deal with so many of these issues that arise during the course of treatment. So when you're diagnosed, the clock starts ticking. Whatever it is, whatever illness or condition it is, it may not be something that is terminal or life-threatening, but if it's a serious condition and it needs to be addressed, then it's up to you to ensure that you're seen as soon as possible. In countries that have different medical systems than we do, for routine procedures, you could wait months. In the States, typically, you can get in to see a provider in short order, but there's plenty of specialties where you can't, where you're waiting a month, 2 months, 3 months. If you find something suspicious on your body and you get it diagnosed as something, or you go ahead and get an MRI or a CAT scan, and there's something suspicious and you're being told that, we'll get you in 2 months, 3 months, 4 months. No, that's not acceptable. My mother was diagnosed with MS probably 20, 30 years ago, give or take. And she has about 20 different conditions as a result of her MS that, they're not good. And one of the conditions she has is a lung condition. And about a year and a half ago, she had a chest x-ray, and there were some suspicious spots on there, and the pulmonologist and the radiologist that read it, said, well, they look a little better than the last time. And my mother's relaying this to me, and the MS has affected her cognitively. She's telling this story about how, they're going to get her in about 6 months. I said, no, you're not waiting 6 months. I said, email me their phone number. I want your records. I want any scans, any x-rays. I want them. I'm not a doctor, so it's not like I can look at most x-rays or chest, CT scans and figure out what's going on. But I know enough to be dangerous. And within about a month and a half, which was still too long for my liking, she was in. So as soon as that diagnosis comes, or as soon as that x-ray gets read, the clock starts ticking. Sometimes you have to push and push and push to get yourself in. When you've got the diagnosis and you've gotten in and you're seeking treatment, whether it's a clinical trial or an appointment time like an earlier MRI or a treatment location or a specific doctor, you may have to push and do it in a way that is uncomfortable to you, uncomfortable to your clinical care team, but ultimately, whose life is it we're talking about? We're talking about either yours or your loved ones. In the case of my daughter, there was a clinical trial that she was on up at Sloan Kettering in New York City. And it was 2 drugs that she was being given. One was through an IV and one was a pill. Well, the pill was being, I live in the Northern Virginia area. The pill was a drug that was being given at the local children's hospital in Washington, D.C., and the infusion, the drug through the IV, could also be obtained there. But because the clinical trial was only being given at Sloan Kettering, it was the only site in the world that was doing this trial, the Institutional Review Board, which approved the trial at Sloan Kettering, said that we had to travel there every single week. So for 6 months, we traveled to New York City, had to stay overnight, sometimes 2 nights, and the cost was astronomical. And I tried to fight to try and get the trial, or at least the drugs, to be administered here in DC, and they said no. Sometimes you win, sometimes you lose. Navigating the back office process. There were points and times where we would get denials on various procedures through her insurance that should have been covered. There were points and times where an appointment was lost on the books, or that, we weren't told that her attending clinical oncologist wasn't available. Again, in the grand scheme of things, some of these were not tremendously important, but, they add up, especially when you're dealing with a long-term chronic illness. My daughter fought for 33 months. My mother's been fighting MS and living with it for 30 years. It adds up, and the strain can take a significant toll. So along with the navigating back office, you may have to push and fight and take control of things with your insurance company. If they decide to deny a procedure, deny an MRI, deny a CT scan, which we had, sometimes you have to file the appeal, and sometimes you have to take it further than that. It all depends on what the situation is, and it all depends on what we're talking about. But ultimately, it's you who's going to be left pushing, with financial concerns. If you don't have the ability to pay for treatment, if it is something that is not within a clinical trial and you need to seek the drug through a compassionate use waiver, you may have to pay for that drug out of your pocket. One of the presentations I gave was upon fundraising for your care. And there's many sites that you can use, and you may have to take matters into your own hands and seek to raise money for your care if it's not covered. And a lot of people are going to find themselves in that position. End of life issues. So when my daughter was put on hospice and she was progressing, we didn't know how much more she had. We had a hospice team that was coming to our house. It started out with round-the-clock nurses for about a week, and then nobody thought she would live past the week that she was put on hospice, and she started regaining some of her strength and some of her functioning. The nurse that was overseeing the hospice care in conjunction with the hospice doctor wasn't a pediatric nurse, and she wasn't really well versed in children with cancer and end-of-life issues. And our biggest concern was pain. We knew that she was dying. We knew that she was going to die, and we did not want her to be in pain. So we took matters into our own hands and contacted the hospice company and told them that it's not acceptable to have an adult nurse taking care of a child who's dying of cancer. And what they did is they brought in a pediatric nurse. They hired a pediatric nurse and created a more robust pediatric program for kids in this area on hospice. And to this day, we keep in touch with her hospice nurse. It was the 6-year anniversary of my daughter's death this past Saturday, and she reached out to us. It made all the difference. So there's other instances. I'm just trying to hit the big ticket ones in terms of when you may have to push and how. Why you may have to act. Inability to obtain a specific type of care. Denial of benefits. Inability to see a specific doctor or care provider. There was an instance when we wanted my daughter enrolled in a clinical trial up in New York, and the doctor who was overseeing the entire clinical trial made a mistake in terms of the way she read her MRI and didn't really truly understand the type of cancer she had, even though she was the quote-unquote primary investigator of the clinical trial, which is the individual who runs the entire thing. And it was very frustrating. And I tried to push to get her in and go to the normal sources that we had, and we were told no. So she wasn't enrolled in the trial, and we didn't get to take that drug or be with that specific care team. And it was upsetting and disappointing. Again, sometimes you win, sometimes you lose. When you are diagnosed, I liken it, the picture I've used, the house on fire, it starts small and then it can just spread. And that's what was happening with my daughter with the cancer is, it started off rather large. She had radiation. It shrank. And then as she was progressing, it just kept growing and growing and growing until it took her life. So as you are pushing for care, sometimes the fire is growing. Sometimes the fire is staying, put, and sometimes you can put the fire out. When you're told there's no more treatment options, sometimes there are. Sometimes there are alternative options that you want to explore. I'm not suggesting that you keep pushing and pushing and pushing, but with that said, there may come a point in time where your care team says, or you're a caregiver, and they tell you, sorry, there's nothing more we can do. And I've heard that way too many times from parents who have kids with cancer. And some of them have taken matters into their own hands. And some are success stories, some are not. I have a good friend whose son is a survivor of neuroblastoma, and it's a cancer of the nerves. A lot of kids that get cancer are diagnosed with neuroblastoma, and in general, it has a decent cure rate, but if it relapses or recurs, there's a 0% chance that the child is going to live. The parents of this child just happen to be researchers, both PhDs, and sat on the bench at the Salk Institute. And my friend Beth Ann knew enough that when she was being told about her son's diagnosis, they went out and had his tumor sequenced. So they knew every single genetic target possible. Again, they were able to do this because of the people they knew, and they decided to go against their doctor's recommendations for high-risk chemo and a bone marrow transplant, which would have wiped out his entire immune system and cost the insurance carrier $1.5 million. So they saved their insurance carrier $1.5 million on his overall treatment. And thankfully, Connor is alive today and doing very well. They were able to do that. They had the means to push to do that. So what I really was interested in talking about was some real world examples and giving some tips. And I'm going to try and run through these two examples pretty quickly. They're extremes. So the example I just gave of Connor falls somewhere in the middle. A father I know in London has a daughter with DIPG, the same type of brain tumor that my daughter had. And he went through the same research and did the same thing that every single other parent whose child is diagnosed with the same tumor does. From day one, you're told that the diagnosis is terminal. There's no hope. There's some new treatments that are being tried. There's phase 1 clinical trials, but nothing's proven. Everything has failed. So he didn't accept that. He went and found every single expert around the world that he could talk to, which is everybody in this community, in this little disease population, knows the experts. Expert after expert after expert said, look, radiation is standard, and then you can try some drugs here and there, but nothing's going to work. Again, he didn't take no for an answer. So what he did is he took 100% control of his daughter's care. Now, he was able to do it because he has some wealth. He's a fairly wealthy individual. He was able to go to a drug manufacturer and obtain a drug that was showing promise in the research and the labs, and have it reformulated so that it can be used in a different way in his daughter. And then he was able to find some reputable doctors in London that he was working with to create a protocol that has worked for his daughter thus far. And she is 20 months into her fight, but he is in 100% control, and he is deciding what drugs, along with his daughter's doctor, who is a reputable doctor who's licensed in the UK as well as in the States. And he is creating a treatment plan, a protocol for his daughter that's pushing the envelope. And it's extremely aggressive, and she's doing okay. Not everybody has the means that he has. I can tell you that we certainly weren't able to do anything close to what he was able to do. We heard stories while our daughter was fighting of people that were able to obtain drugs that we weren't able to obtain, but we tried and we failed. So that's one extreme, and that's one example of being able to take complete control of your care. Another example is one that I've spoken about here and there in some of my presentations. Woman I know named Carly has a child with autoinflammatory conditions and a number of other conditions that, whether or not they're related, nobody really knows. He's a patient population of one in the entire world. And he lives in Cleveland, and he is seen at the Cleveland Clinic, which is obviously a fine institution, and he's also seen at the NIH in Bethesda, Maryland. Well, they decided, the team got together and they decided that he needed a drug, and rheumatoid arthritis drug that was to be injected every single week, once a week, and that's what they were going to try to shut down his immune system, essentially, which became overactive. And he would spike fevers of over 107. He would spike fevers of 107.2, 107.4. His body, you couldn't even touch him. He was so warm. And once the fever gets above like 107.8, 107.9, organ failure starts happening, and there's no reversal. So it's pretty serious. Well, the drug that she was prescribed was $12,000, $13,000 a year, somewhere on there. Wasn't covered by her insurance because it's not FDA approved for his indication. So she didn't know what she was going to do. She was running out of options. Basically, she went to the drug manufacturer and started at the first person who answered the phone and said, look, this is the situation. My kid has this condition, and if his fevers spike over a certain level, he's going to die. And First person said, well, I don't know what we can do. And she said, okay, let me talk to your supervisor. She kept going up and up and up and up until she got to the right person. And finally, she got to the right person, and she basically said, look, if you don't do this, I can't afford the medication, because she works but doesn't make a lot of money. And again, insurance wasn't covering it. She basically told the person who was vice president that her son's going to die, and if he dies, it's on his lap. And sure enough, they are now providing her the drug free of charge. Every single week, she gets a shipment. She gets the syringes. She gets the drug. She does the injection. And knock on wood, he's had a few flares here and there. And it seems to be holding things at bay. So, two extreme examples of pushing for your care and really taking it to an extreme measure. Obviously, if you have the money and can do it, well, then there really aren't that many obstacles. Although sometimes drug manufacturers put an obstacle in your way if you're trying to obtain a drug. And even if you're willing to pay for it and try and obtain it on compassionate care or compassionate use, you can't obtain it. But obviously, if you have the means, things open up a little bit more for you. If you don't have the means, then you just have to advocate and push and push and push, and don't take no for an answer, especially if there is a solution and you're in a situation where it is certainly life-threatening. Emails, phone calls, social media, letters, they all work. They all can have the same impact. Getting people to call the drug manufacturer, getting people to call the insurance company, whatever it is, doesn't matter. Again, it's your life, it's your loved one's life, it's your friend's life. If you're not going to, at the end of the day, advocate and push, then the fate can be sealed. So, things to think about in the end. What are the consequences of your action? I talked about this in other presentations. I don't necessarily believe that any of my actions ever were detrimental to my daughter's care. Relationships sometimes suffered here and there, but I don't regret anything that I had to do. I was trying to save my daughter. So, you do what you have to do within reason. How critical is what you're seeking? The MRI examples. There was one time where she was supposed to be first in the morning, 7:30, and 12 o'clock came around, and we were getting really, really upset. 1 o'clock came around, and there was a few babies that they slid in before her, and she was getting miserable. It was not a fun situation. By about 3 o'clock, we decided that we couldn't push anymore, and we were going to pull the plug, that we would come back the next day or the day after, whenever they could get her set in for her next MRI, and that's what we did. It was critical that she needed the MRI. It wasn't critical enough to raise that much hell with the administrators, and so we made the decision that we pulled the plug on it and took off. What happens after I act? So there was an instance when we didn't get on that clinical trial in New York, and I emailed one of my daughter's main neuro-oncologists at NIH, who I had a really good relationship with, and I basically said, look, somebody messed up. You need to call and explain why she needs to be on the clinical trial. And, this doctor called me up and said, I don't need to do that. First off, you need to actually approach me with a little more kindness than you're doing now. And no, I can't do that. And it, our relationship took a little bit of a hit. Thankfully now, I have a really good working relationship with her. I sit on a committee at the National Cancer Institute through the NIH that looks at various clinical trial concepts, and we review them and decide whether or not they get initiated. But that could have truly destroyed that relationship. And it's a person who I've actually needed since my daughter's death and in my professional career. So what other options exist? Is there something else that you can do short of calling up the vice president of the company and telling them that they're going to kill your child, or you're going to die because they're not acting? Is there something short of that you can try and do? If you're talking about, you're getting a bill for your MRI that isn't covered by your insurance, and it's $1,100, $1,200, $1,300. Is there somewhere you can go to try and get help to get that paid for? Can you push through your insurance carrier and see about making that happen? Obviously, as things happen with the Affordable Care Act, with Obamacare, and that falls off the cliff, things are going to get a little bit more dicey. That's why I put the domino graphic there, because I think that sometimes in the healthcare world, it's like dominoes. Once one falls, everything else falls along the way, unless you've made a mistake spacing them out, then maybe you get lucky in this case. But, things are going to get interesting, and not in a good way in a lot of respects for at-risk populations like kids with cancer, underserved populations, minorities, people without health coverage, obviously. Is there anyone out there to help? Again, do you have somebody that you can contact to try and advocate for you? You may be the person that's out there to help, that is in the role of caretaker. Can you research, is there anybody else who has gone through what you're going through, or what your loved one is going through, that can give you some advice in terms of what they did, what worked, what didn't work, what considerations they have? There's always resources out there. Hopefully there's always resources out there. Sometimes you win, sometimes you lose. Sometimes you're told that there's no further treatment, and that's that. In the case of my friend over in London, he didn't accept that. He was able to do that. That's not the norm, though. But, again, if you can do it whatever way you're possibly able to do it, then, it's your care. It's your loved one's care. It's not the hospitals or the clinics or the nurses or the social workers or the doctors. They may all be very caring people, but at the end of the day, as soon as you vacate that room, the next patient's going to walk in. And, that's not saying that they're awful people, but, their backs are up against a wall, and they're working within a system that doesn't reward them for spending time and trying to figure things out for you and with you. So ultimately, the buck stops here. So with that, I'm going to go on to questions if anybody has any. I'm going to unmute everybody. And again, if you have any questions, anything you want to share, any examples where you may have faced a situation either yourself or as a caregiver that you've had to, take the nuclear option.
Yeah, I have a question. You were talking about how, in one example, I guess a woman called up the pharmaceutical company and said, if you don't help me, I don't have the money to pay for the pill. And if my child succumbs, then it's going to be on you. Is that correct?
Yeah.
Okay.
More or less.
So what do you think is the most compelling argument, or what's the best strategy you would suggest a person in that situation use with respect to, getting the medication on as a result of compassionate use, or under those auspices? Do you start with by saying, by giving a desperate emotional plea, or is there a more logical approach that you could start with? And, are there any tips or tricks or strategies you might suggest along those lines?
You know, that's a good question. I don't think there's any one answer because you don't know who you're going to run up against in terms of who you're going to ask. You know, I think that the best approach is to start off very logical and don't make threats. You know, explain the situation, explain why you need the drug or the treatment, explain why you can't afford it. What's going on that is keeping you from obtaining the treatment from in the normal course of things. And sometimes you have to tell somebody that if your child dies or if you die, it's on their shoulders. There's another instance that I was involved in trying to obtain a drug for a kid that had been battling cancer for 4 years, and he had a bone marrow transplant as part of his treatment. And a lot of kids develop an infection after bone marrow transplant called the adenovirus. And he was being treated at St. Jude. Well, his doctors had done a clinical trial of a drug that they knew would most likely give him about an 80% chance of wiping out the virus if he took the drug. And his doctors also knew that if he did not get the drug, he was probably going to die within about 2 weeks. Well, the drug company that was manufacturing the drug is a very small company in North Carolina. It was the only drug that they were manufacturing. They had previously given the drug through the compassionate use channels, which basically very quickly, it's very complex, but essentially if you want a drug and it's not FDA approved for your condition, your doctor writes a letter to the drug manufacturer and submits an application to the FDA. The FDA 99% of the times says, okay, you want it, go for it. It's the drug manufacturer ultimately that decides whether or not they're going to give the drug, because there's a cost to the drug manufacturer and there's other issues for considerations. In this case, though, the drug manufacturer created it once they had the drug in a phase 3, which is the end. Basically, they saw the finish line. They saw the goal line of getting this drug FDA approved. And they were also going to get a contract from the U.S. government for using it for the military. There was going to be a lot of money at the end of it. They said no more giving the drug in compassionate use. So what happened is the foundation that I work for, the Max Cure Foundation, the vice chairman is a former trial lawyer and started out very kind, very nice, you know, look, we're trying to get the drug. And as they kept saying no and no and no, the CEO, you know, came back and said, look, you know, we can't do it. It's going to cost us money. So he said, okay, how much money do I have to raise? And he said $50,000. Well, my organization put out a huge social media campaign and within 3 days had like 1.5 million social media hits. It had pledges of up to $250,000 to get this drug. The CEO said, nope, we're not going to do it. Even though you raised the money, we're so close to the finish line. Ultimately, the pressure that the CEO was under from the social media campaign, including death threats, his family had to be hidden by the FBI and protected, which I'm not suggesting make death threats by any means. Ultimately, he worked with the FDA to create a phase 3 clinical trial written basically for this one kid, and they flew the drug down to Memphis and wiped out the virus, and the kid lived. That's another extreme instance of, you know, where it goes from a very level point to, you know, 0 to 60 in 2 seconds. It all depends. Any other questions?
Yes, I know of a case that's ongoing now whereby it's a drug, it's kind of expensive. First, the manufacturer was offering it complimentary, and now they said that they've changed their policies. Okay, you had to go through your insurance. The insurance said they need approval from the physician. The physician said sent the approval, and now the insurance company is saying no.
Wow.
What would you do in a case like that? You're paying insurance all the time, and now that you need this particular drug, they're saying that, you're not approved to get because it's that expensive.
Yeah. If it's the insurance company that is stopping it, they can be more of an obstacle than the drug manufacturer themselves. Because ultimately, as long as the drug manufacturer has a stock or a supply of the drug and you escalate the pressure, I'm not going to say always, but there's a good chance of them caving. In terms of the insurance carrier, that's tough. If you've gone through the appeals process and escalated it as high as possible, then, my recommendation is to take it even higher. Take it to the CEO, contact your congressperson and ask them if they can write a letter on your behalf. And I've also seen instances, if you do go to your congressperson and explain the situation, they will sometimes go to the FDA, and the FDA can pressure the insurance company. So, if you're getting a roadblock at the highest level, go higher. Email your congressperson, call the congressperson's office and ask to speak with their healthcare policy, legislative aid, explain the story, and tell them you need help. And 9 times out of 10, they will write a letter for you. They will pick up the phone and call the insurance company, and they'll try and put pressure. But there's always somebody higher.
Okay. You think maybe the media should get involved too after paying insurance all these years?
Oh, absolutely. Yeah. Don't look. If you are at the highest absolute level and it's the highest absolute level with a no, then, you're left with a choice. Accept the answer or continue to fight. And there are manners and methods to push that put the heat on them, and they don't like that. So, especially with an insurance company, going to your congressperson, they can, insurance companies always get concerned about investigations and being looked into. That's what I would do.
Okay. All right. So congressional would be a good way to go then.
Absolutely. Yeah.
Okay.
Yeah.
All right. Thank you, Jonathan.
You're welcome. Anybody have any other questions? Anything else they want to share? Well, thank you everyone for joining tonight and for joining over the past number of weeks. As always, it's been a pleasure to present to you, and hopefully there's been some information that you've been able to glean or get out of tonight's topic that will help you in the future. And as always, if you have any questions, my contact information is down at the bottom there. You can reach me through my website or through Twitter, or just Google my name and find me any number of ways. And appreciate your time and appreciate the questions. So thank you very much, everyone. Good night.